Health IT leaders reduce clinician burnout and enhance efficiency with Ambience Healthcare. Their AI-powered platform automates clinical documentation, coding, and administrative tasks, allowing clinicians to focus more on patient care. Seamlessly integrating with EHR systems, Ambience improves workflows and patient outcomes. Ready to revolutionize your healthcare operations? Visit thisweekhhealth.com/ambience today and discover the power of AI with Ambience Healthcare. Today on Newsday.
It's not just what you do in the room or medication you prescribe, but it's getting that person truly bought in to making a change in their health, which is honestly only possible when you can build an authentic relationship. And I think AI has this beautiful opportunity to make that possible at scale.
I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Newsday discusses the breaking news in healthcare with industry experts. Now, let's jump right in. Well, good morning and welcome to Newsday. We've got Nikhil Buduma with us today. He's a leading figure in applying AI to healthcare. As the co-founder and chief scientist of Ambience Healthcare, he has been instrumental in developing AI solutions that alleviate clinician burnout and enhance patient care. Ambience's AI platform, adopted by institutions like Cleveland Clinic and John Muir Health, integrates seamlessly with EHR systems to streamline clinical documentation and workflows. Nikhil, thanks for joining me on Newsday today.
Of course, it's been an exciting week, so there's a lot to talk about.
There's always a lot to talk about in these spaces. And we've got three really fun just topics to cover. And the first one, AI doctors surpassing human physicians in history taking and diagnosis. This was a LinkedIn post by Dr. Ethan Go, highlighting two landmark studies published in Nature, demonstrating that AI systems can outperform human doctors in taking patient history and diagnostic accuracy with simulated environments. So much to cover. You have such a lens into this space. What are your initial thoughts?
I think it's exciting, but it's also not surprising. We've seen this sort of class of technologies become very good outside of healthcare. People oftentimes talk about these models starting to automate so much of the software development workflow. And I think even Bill last week was talking about how he's using things like Cursor to bootstrap applications from scratch. It's kind of incredible how good these models are becoming at reasoning. And so it's not surprising that models are actually very good at taking information inside of a clinical case and starting to use that information, do reasoning on top of it, and come to really effective predictions as to what diagnosis a patient might have. I think that we should expect these capabilities to get better. The cycle times on new generations of models is really starting to compress. And so while the results that are in both of those Nature posts are impressive, I think we're very far away from the ceiling of where this technology can go. What are your first reactions, Sarah?
So I'm a big fan of all the things that we're hearing in terms very specifically about being able to reduce some of the burden on physicians. So you consider that the models that are trained on these vast data sets can now generate differential diagnosis and recommend treatments with high accuracy. Maybe that cuts down on the time it takes you to get to a specialist or have your PCP being that true intermediary for you. But also collecting the patient history, it proposes care plans. You can review and finalize. You can enhance efficiency. And then with these tools that are listening and providing explanations, it also increases satisfaction and understanding on the patient experience side. And that's what I love most about what you're doing specifically, is that the operational benefit, the mitigation of clinician burnout, the elimination to a degree or the addressing of a staff shortage, and that just overall patient experience. Like you address so many things in one problem that's been out there for a long time. It used to be you needed a point solution to fix one problem. Now you have, to a degree, Nikhil, these platform point solutions that are addressing multiple aspects of your organization. And it's always with the patient and the clinician in mind first. And technologists sometimes get in front of the technology first.
You're making a ton of really good points. It's almost like, imagine having a clone of yourself that's able to do all the things that would normally require your level of expertise to do well, but detract away from practicing top of license. Like, imagine if you had a world-class fellow read the chart before you walked into a room and could say, hey, this is what's going on with the patient. This is what I think we might want to talk about during this visit. That's a lot of time that people spend today personally pouring through charts to prepare for a visit. But imagine if all that could be handled by an AI. And I think You're absolutely right that it's this unlock in clinical reasoning that creates systems that actually can start to take more and more of this administrative burden off the plates of physicians, because you kind of do need something really smart to queue you up for success. The data in the EHR is messy. And I think, the two papers are really exciting, but I think there are some limitations, obviously, to what they're talking about, including it's a purely simulated environment. You and I both know how messy the data inside of the EHR is, and reasoning over real world data is going to be a whole different set of challenges compared to reasoning over a very sort of simply structured case. Also, diagnosis is only a small part of what a clinician does, right? You talked about how it's not just about making a diagnosis, but it's about designing a care plan. It's about knowing when that care plan is not working. It's about retitrating that care plan when potentially you've got heart failure, but your diabetes worsening, and all of a sudden your heart failure medication is not working. And so there's actually so much surface area that's still untapped, and automating diagnosis and history taking still such a small part of that surface area. But I think it is very exciting. I agree where this technology is about to go.
Well, especially when if you're a CIO, CMIO, we just spent a weekend with them, is understanding the capabilities and limitations of what it can actually do and how you integrate them effectively. But every single physician we talk to is like, I get to spend more time looking at my patient. That alone, that human connection. So we often talk about where's the human in the loop with AI. Well, the human in the loop in this case to me is not just the accuracy of what's being produced by AI, and obviously the physician has to sign off on that. It's the human in the loop in terms of the ability to spend more time with a person. And when people are sick, they want their doctor to like look at them and know how they're feeling and not be worried about if the right billing code got captured and how fast the claim gets out the door. Patient doesn't even know about that stuff most of the time. And so when the doctor doesn't have to worry about it anymore, or anybody in that clinical setting, we are bringing so much life back into the whole point that anybody who practices medicine went into it for in the first place. And that's the human connection, the ability to heal people.
I think it's very exciting. A lot of physicians are starting to realize what it feels like to not have that burden on their shoulders anymore. You get to look people in the eye. You get to build that authentic human relationship. And it's that relationship that also helps you get people invested in their health and to buy into that behavior change that can be so important to addressing things like chronic disease. Those are oftentimes the biggest predictors of long-term health outcomes. It's not just what you do in the room or medication you prescribe, but it's getting that person truly bought in to making a change in their health, which is honestly only possible when you can build an authentic relationship. And I think AI has this beautiful opportunity to make that possible at scale.
Yes. And I love that we're not creating products that are about volume. We're creating products that are about efficiency and connection. There may be a volume aspect to it, and that's more of a probably a nuanced conversation, sometimes per physician. But we do have to address aging populations. We do have to address clinical staffing shortages. And this becomes, I feel like honestly, for once, we're getting in front of the problem first because we know that it's coming. And we don't usually do that in healthcare and technology. Usually the technology fixes something we created in the first place. Well, guess what? We're actually way ahead of that curve, I feel like, in this scenario. So I'm grateful to see where things go. And I'm also grateful for products like Ambience because it makes you excited about being able to take care of patients in the best version of yourself as well.
Hopefully, we extend the careers of folks by 5, 10 years because it's less burdensome to be in healthcare.
Well, and we need them. Here's what I love next too that we found: evolution of hospital operations over 25 years. The first disclosure I have to admit is that, yeah, I started my hospital career 25 years ago. So in 2000, that was my first hospital job, not my first IT job, but first hospital job. And I was joking with Reed Steffen from St. Luke's over the weekend. We're like, what was the name of that one carrier that allowed us to like have gigabit infrastructure way back in the day? And we finally found it and realized they're out of business. They've been bought. But back in the day when you were replacing green screens and putting in gigabit backbone networks. But this is amazing. It was the transition from paper to digital, that hospitals moved from paper-based records to comprehensive EHR systems, which at the time was about enhancing data accessibility. For the first time, we had data sharing. The patient could get their information across multiple departments. You never longer had to send things through a pneumatic tube for results between different floors, even in some cases. We had the incorporation of scribes, and telehealth has changed how clinicians interact with patients and documentation, advancement and treatments. We've got the introduction of immunotherapy. Targeted therapies have revolutionized cancer care. But most importantly is the patient empowerment aspect. Increased access to information has led to more informed patients who actively participate in their care decisions. All of that being said, we've come so far and we have so far to go, which is a lot about the problem that you have recognized and are solving in our industry. So when you think back on, my goodness, a quarter century of hospital operations and healthcare, what's most important to you about what you're doing for the next 25 years to really continue to change this curve?
I was about to pose that to you, Sarah.
I'll answer after you.
In some ways, I heard this, I can't remember who it was, but it was at a previous 229 event where someone said, you know what, in many ways, the EHR succeeded in what it set out to do. It set out to make data more interoperable, and it set out to improve patient safety by leaps and bounds. And you look back on the last 25 years, I think it's pretty non-controversial to say that the EHR actually successfully improved both of those axes. Obviously, it's not without its faults. And one big oversight potentially is the data's got to end up in there somehow. And who's going to be responsible for making sure the data ends up in these systems of records? And I think what has unintentionally happened over the last 25 years is our most highly skilled clinical professionals have sort of woken up and realized that while these systems are incredibly important to the practice of medicine and delivering better care to patients, it also has turned them into manual data entry specialists, which is not really wasn't part of the job description when they entered medicine in the first place. And I think there's potentially other components too, where it's brought, in some ways, the complexity around coding and billing is a whole other area of sort of change over the last 25 months. One could argue that in some ways, EHRs have helped at least sort of alleviate some of the complexity around coding and billing for the clinician. But I do think that sitting here, on the one hand, we've done a great job with sort of data interoperability. We've done a great job with patient safety, but the administrative burden is still high. And while the administrative burden is still high, it does also mean that it's often harder to trust the data that's inside of the system of record because it was often entered by somebody who didn't really want to do it, who was probably burnt out, might have been falling behind. And so it's no surprise that oftentimes you've got missing and contradicting information inside of the EHR that people have to navigate all the time.
Except that now, to your point, with every intent of the innovation or creation of something, it causes different problems as well as solves different issues that are out there. The advent of the ability to really have people leaning into data governance and data management and digital tooling as careers. These weren't careers that existed 25 years ago. We had a bunch of database analysts. You had people that knew how to manage SQL. That was a pretty sought after role at the time. The SQL administrators were the highest paid people on the team, even though you still had like some legacy COBOL people floating around and people that like kept the AS400 alive no matter what, or your system's 36 or 38. And yes, I've been around that long. The type of acuity from the application of what people were doing that became advanced as well to me was so fascinating. Some of these niche aspects, your web programmers that came on board, just your security analysts that had, we said one guy in security 25 years ago who would make sure that the vendor assessment had some very basic elements built into it. And now you have security teams because of the complexity of everything that's going on. So what I love about the evolution of healthcare, it's created an entire industry of professionals, really the STEM spaces, that are so critical to everything that we're doing today. The advancement technology has been everywhere, not just in healthcare. And people give healthcare a bad rap because it's behind. Sometimes, yes, it's behind, but it's also because it's more risk adverse because of what's at stake. Most jobs don't put human life on the line every single day. And even if you're the programmer behind the scenes, that code can affect a patient's life. So we take a little bit slower path to adopt the things that are out there. I do believe, though, we'll continue to see the acceleration of adoption of certain technologies in healthcare, like we are with AI as an example, because we have to. And we've proven through all of these years that we can successfully build out systems that have a responsible nature to them. We've just accelerated that entire curve.
Sarah, a question for you. Maybe hard to project 25 years, but I'm curious if you had to project 5 or 10 years, what do you think is going to be different about healthcare in 2030 or healthcare in 2035?
How about if I tell you what I want it to be versus what I think it'll be?
Okay.
That's the ability to probably have an avatar to a degree as my primary intake for my
Mhm.
care, because the avatar is going to intake everything happening all the time in real time. There's still a person with whom will be almost my social, not social, but maybe like my health coach. And that's where my doctor steps in. And whether it's a PCP or some level of a specialist who's able to integrate all of the information coming to them, they become the hub. They become the delivery mechanism by which I'm having a thoughtful conversation about how healthy I am, my habits, my behaviors, my medications, my conditions, whatever's happening in my life. But I have one person. The coordination of care is handled by technology. And so I have one person with whom I need to speak, because today, still trying to go to multiple specialists just to get like your hip figured out is time consuming, and you have to understand how the system works. So I'd like to believe that we remove the friction in understanding healthcare, remove the friction in how to even get what you need as a patient. And that honestly, to me, is also universally available to people, regardless of your politics. I do believe that, especially here in the United States, healthcare is a right. And we need to make sure that people have access and equity to care that is not biased in how it's produced, even if it has a computer back end to a lot of the decision making, because we have people who can now focus on those patients versus everything else around them, which we've discussed as the previous aspects.
That is an exciting vision. In some ways, turning this very episodic, convoluted interaction with the healthcare system into one continuous conversation where you've got, let's say, like an AI agent that's now sort of like the steward of your care, your navigator, and your coach. I think that's an incredible vision. I don't think that's that far off. I think you're right. That's going to happen in the next 5, 10 years. And I think it's going to be a step function improvement in the quality of experience for the patient.
What do you want as a patient? Because even today, you can breathe into your metabolic device and wear your wearable and do all these things, but you are still coordinating all of the peripheral things that are available to you as a consumer. So, as a patient, what do you want it to be in 5 years? What's our conversation in 2030?
I'll build upon what you shared and also maybe tie in some of the elements from the previous article we talked about. I would love for care to be less about generic protocols and more about a deep understanding of me as a person and what's the right sort of personalized precision intervention for me given my genetics, genomics, my social history, my preferences. And it's not to say that the state of medicine today makes it hard to deliver that. I think we know a lot actually about the human body. We know about, if we had infinite time and all the right experts in the room collaborating on everyone's care all the time, I think we could make incredible decisions and really bend the cost curve. But the reality is, structurally, we're not set up to be able to deliver care that way. And what would be incredible in 5, 10 years' time, which I think will require some work with CMS and the FDA and health systems to come together and work very closely with people building an AI. But I think there's a version of the world where you could be in a critical access hospital and a clinician can be with a patient clicking a button and accessing the sum total expertise of the world's best specialists in that interaction to deliver the best possible care to that person in that particular point in time. I think that's not science fiction anymore. I think AI and how it's integrated into the workflow and the ability to have the right sort of governance and regulatory infrastructure to know these technologies are safe, I think that's going to be solved in the next 5 to 10 years.
And the better accuracy and quality and engagement leads in theory to lower costs, which means we could take care of the higher acuity that's going to happen, just because no matter how well you take care of yourself, aging is aging. You get older, and it's just, you got to take care of things differently. Like your car, if you're a 20-year-old car, I don't know what a car's life's like, the equivalent, like a cat and dog's like what, 7 years. I don't know what the car is when it comes to a human life. But if there's some like constant care and feeding, but things break and people need that level of like ability to know what to do. You remove, just pull off the cloak, take the curtain away, and informed citizens are going to make better decisions. So I love that. But here's a fascinating one too. We'll end with this article, and this is right out of conversations that Bill likes to have. The healthcare is misunderstanding cloud computing, and we got to house all this information somewhere. We've got to have all this data available. And Bill consistently is debating the persistent misconception about cloud computing and some of its benefits. So I'll just touch on many healthcare organizations, they lack fundamental understanding of cloud characteristics, which means they may not utilize it effectively. Adoption of the cloud, it can be scalable and cost efficient and improve access to resources. The thing is, it's also very expensive if you don't know how to manage the finances of it. I used to always say, you can get everything in there pretty cheap. It's really expensive to get it back out in a way that is meaningful. And as we shift to platforms and these models that provide flexibility, yeah, the service models will continue to change. Security and compliance is rougher. The concerns about data security and compliance are always going to be a challenge, even though there's so many advancements. And more importantly, the ability to really understand when, how, and where to utilize these technologies that are available, whether you're the CISO, the CIO, the CMIO, the digital officer, anywhere truly in the healthcare C-suite, you have to continue to, I guess what we like to say, demystify the cloud, but really teach the organization about how data is used, where it's housed, how we're paying for it to get in and out of the systems, what do we actually need to be keeping for periods of time. All of that is not just an IT conversation anymore. It is a universal conversation because you hear it everywhere. Now that it's mainstream, what can we learn as consumers that also apply to us in areas like healthcare to manage all of the things that you and I just talked about?
100%. Sarah, I will never be as much of an expert on cloud for healthcare as you and Bill. So I'm actually curious to hear, what do you think are the like one or two biggest conceptual mistakes that health IT professionals make when thinking about reasoning about cloud and how it should be used in health systems?
I'll speak most recently from where I came from. Now, Tivity Health, phenomenal niche in the healthcare space, really serving Medicare Advantage seniors, also some commercial partners as well. But what was most interesting was, do you have to be in the cloud to be successful as an organization? Is on-prem still a viable option? What's funny is you see every pendulum, like on-prem to cloud. Some people are going back to on-prem in some cases. Some solutions you always had to leave on-prem because of the size of the data at the time. I believe one of the first misconceptions is believing that you have to go to the cloud at all. Like really understand platforms, where they're hosted, how they're hosted, what should be on-prem, what shouldn't be on-prem, what's going in there. Do I need a multi-cloud environment, or can I just diversify with a singular partner? Keeping your partners honest as well. So if you've got Google, you've got Microsoft, you've got AWS, how are you balancing what one offers in some spaces and the other? I'm a big fan of multi-vendor strategies because I think it creates competition, innovation, and allows you to have some flexibility because you have an outage or an issue with one. Unless you've got a really great diversification path, you're going to have potentially a bump in certain services. It's how I feel about PACS. It's how I feel about just different aspects of where you are practicing medicine. That's a different conversation though for like critical access or community connect partners as an example. So the care setting is key. Really know, what does your organization need?
Hmm.
How is that financially viable? Is it now a capital expense, an operating expense? Who's going to be managing these systems? What kind of expertise do I have in-house? Do I actually need a third party to do this with me? You don't need to hire an expensive consultant now, though, to figure it out. If you've got some really great partners, especially in your platform solutions, bring them together and say, hey, the four of you are sitting here in a room together. This is what I need to be thinking about. This is what I'm up against. And here's where I want to be in the next 2 to 3 years. Guess what? They will come together and work with you. To me, it's a crime when you don't have your top partners in a room together, being a cohesive group to help you manage your system. So if you've got Salesforce and you've got AWS and you've got, let's just say, Ambience and you've got Rubrik all in the room together, they need to appreciate what is the mission of the organization and how do you, as chosen partners, because there's not lack of choice in most of our solutions today, how, as chosen partners, do you help us be successful?
This is a great point. And actually, it's very timely because it's actually come up for us a number of times in the last 6 months where our health system partners will bring us and Microsoft in a room together and say, we're thinking about holistically our cloud and AI strategy. How should we, and this is how we're thinking about our goals. This is how we're thinking about our budget. How do we come to a good structure over the next 3 to 5 years that is financially sustainable and actually helps us to accomplish all the goals that we have as a system? And I think we're seeing more of these conversations where it's not just, I'm going to have a conversation with my cloud vendor, and I'm going to have a conversation with my AI partner, and I'm going to have another conversation with my document management solution. And instead saying, let's just all get in a room and talk about, this is the strategy, this is what we're trying to accomplish. How do we work together to make that possible? That's an incredible idea. And I'm putting two and two together. I'm seeing that happen more and more often nowadays.
You have to. Because the other piece is, you did it this past weekend, people are like, oh my gosh, where do I get some of this education? You're like, oh, I've got a bunch, I'll send it to you. What our partners, and truly, let's say you buy the research license for AI, what it can provide to you as well. You're freeing up the ability to like be really thoughtful and deep research and conversations, both what you can do yourself and what you can expect from your partners. And I've said to partners before I sign on the dotted line, it's your responsibility to help us stay current on XYZ. What is coming next? What are the new technologies? What are the regulations? We're going to do it too. Let's match those learnings together because we're probably going to teach each other things we weren't aware of. Because your partners, if you are a CIO, whoever your partner is, they're talking to 20, 30, 40, 50 CIOs every week or every month. That's why I love our 229 summits. You're getting hundreds of perspectives in a room with 20 people because everyone is crowdsourcing the information they're hearing and learning all of the time. You're actually so much more informed when you're doing that. And for those that are more introverted or shy about spending time in these group settings, you got to do it today because there's absolutely no way you're going to keep up on your own. And that's true more so than ever before. So our goal, provide those platforms that allow that to be a true statement. And we're grateful we get to do that with partners like you.
I appreciate it. It's about to get more complex, which is definitely, I think, probably anxiety inducing for a lot of leaders because AI is a whole new wrench in the cloud stack. I think it was Dr. Sanner from Loma Linda who mentioned this over the weekend. I think we were talking about how the role of the CIO is about to evolve from managing applications, whether they're deployed on premise or deployed on the cloud, to managing AI agents. And these agents have very sort of different compute characteristics, very different data governance protocols from traditional software applications. And it's going to complicate the cloud strategy in a way that I think it's not just going to be about what's your cloud platform and your cloud strategy. It's also going to become what's your AI platform and your AI strategy. And cloud and AI are going to become largely interconnected and interdependent in a very sort of interesting synergistic way over the next couple of years. So I'm also very excited to see sort of how this conversation continues to evolve as we start to move further and further towards using AI agents to do more of the work inside of health systems, like we've been talking about over the last couple of days.
And you had John Doerr at your recent conference talk about the speed by which things evolve. Was that things every 13 to 14 years, these big revolutions come through. This will shorten that timeline for sure. And hey, here's where I say to people, if that's the world you want to live in, you're going to have an amazing career as a CIO. If that terrifies you or you're like, I just don't want to keep up anymore, then there will still be enough, to me, I think, legacy opportunities for a period of time. But honestly, the apex, if you're 35 and in this industry and moving up through this space today, that's your new edict. That's the way you have to learn and be willing to function and grow. If you're looking to sunset more towards career opportunities, then you just got to keep up well enough. But to me, that curiosity engine isn't ever going to stop. I'll be the 80-year-old person who probably has every gadget possible and like telling all the kids about, I used to do this. But it just depends how you're wired. But a lot of people who went into, I want to maintain a data center, or I love this aspect of my job, they will need to retool. There's a lot of retooling, I think, mentally in terms of also how kids are learning what we're learning in colleges today, which is why you're also seeing a decrease. Did a podcast about a month ago with one of my girlfriends who teaches PhD programs at Lipscomb in Nashville. And she said, less and less people are getting these advanced degrees because they're going and get these certifications that allow them to keep up with the pace of what's happening across the world today. And I believe that will continue to be a true statement as well. So I'm hopeful that it also becomes a bit of an equalizer in terms of expectations and career options for people because it is moving quick. And if you don't want to be on that bullet train, you got to really rethink what could be next. But there is so much opportunity out there. It's probably one of the most exciting times to be in healthcare right now.
If there's one saving grace, it's probably this, when the tool set may be changing, but the reality is there's no substitute for deep understanding of the problems. There's no substitute for having the confidence that the thing that you're automating is the right thing to automate. And that comes from experience. It comes from battle scars from actually tackling real problems in health systems. So I personally think the best outcomes are going to come from the right collaboration between new folks who are really adept at using these new tools, partnering with leaders who deeply understand the problems of healthcare and the challenges of delivering solutions that work in the real world.
And I agree with you more. And guess what? We're all patients first. So we are the best inputs for the solutioning of the things that need to happen. I remind people all the time, put your patient hat on first. What do you want the experience to be? Work backwards from there, because hey, if you're the technology group, you actually have the ability to influence that better in some cases than others, because you know what the art of the possible looks like, because you're seeing and feeling it every single day. And so I'm hopeful that it's re-energizing a whole slew of careerists that know that it's harder than it's ever been before to be in healthcare from a regulatory perspective. And yet from a technological perspective, it's also the most advanced and most exciting. So bring those two together. They basically balance a space where we can all thrive and be successful. So thank you so much for taking time to cover the news and continue producing amazing solutions for our practitioners and our patients out there. What you do is exactly what is needed right now and for the future.
An exciting time.
Thanks for listening to Newsday. A lot's happening in our industry. And while Newsday covers interesting stuff, another way to stay informed is by subscribing to our Daily Insights email, which delivers expertly curated health IT news straight to your inbox. Sign up at thisweekhealth.com/news. Thanks for listening. That's all for now.